Should mesothelioma patients be considering the drug ipilimumab if they want to extend their life expectancy and improve their quality of life? That is what we will be covering over the next couple of minutes. Hey, I'm Deborah from survivingmesothelioma.com, and for almost 20 years now, we have been helping mesothelioma patients with the latest in mesothelioma treatment information. In today's video, we're going to explore 4 exciting ways in which ipilimumab might improve the lives of mesothelioma patients. But first things first, what is ipilimumab and how can it help you if you have mesothelioma? Ipilimumab is an immunotherapy drug that works by blocking a protein called CTLA-4, which normally puts the brakes on the immune system. By inhibiting CTLA-4, ipilimumab unleashes the immune system to better fight cancer cells. And after having an in-depth look at 5 studies from journals like The Lancet, the Journal of Translational Medicine, and Clinical Cancer Research, it looks like ipilimumab could significantly extend overall survival for mesothelioma patients and potentially improve their quality of life as well. I'll leave links to all of the studies in the description for you. But how exactly can ipilimumab help mesothelioma patients? Let's take a closer look at the 4 ways that ipilimumab may help. Number 1, ipilimumab extends overall survival by enhancing the immune response against mesothelioma. A study published in The Lancet in 2021 looked at how malignant pleural mesothelioma reacted to treatment with ipilimumab plus another immunotherapy drug, nivolumab, in a phase 3 clinical trial in humans. Phase 3 means that the treatment was tested in a large number of human patients to confirm its effectiveness and monitor side effects. And what they discovered is that ipilimumab plus nivolumab extended median overall survival to 18.1 months compared to 14.1 months with chemotherapy alone. This basically means that, on average, mesothelioma patients lived over 4 months longer when treated with this immunotherapy combination. Imagine getting an extra 4 months or more of life to spend time with your loved ones. Number 2, ipilimumab may work even better for aggressive subtypes of mesothelioma. Next, the FDA approval summary published in Clinical Cancer Research in 2021 showed that ipilimumab plus nivolumab was particularly beneficial for patients with non-epithelioid mesothelioma. Non-epithelioid tends to be more aggressive and harder to treat than other subtypes. They found that the survival benefit of ipilimumab plus nivolumab was even greater for the non-epithelioid patients compared to the overall study population. Think of it like a secret weapon against the toughest mesotheliomas. I mean, how incredible would it be to have an effective treatment option for even the most difficult to treat cases? Number 3, ipilimumab shows effectiveness in the real world, not just clinical trials. What I found truly amazing was that a French study published in the Journal of Clinical Oncology in 2023 demonstrated that ipilimumab plus the nivolumab showed comparable effectiveness in a real-world early access program as it did in the rigorous clinical trial. The real-world median progression-free survival was 7.8 months, and the 1-year survival rate was 65%. Very promising results. that weren't too far off from the clinical trial benchmarks. Okay, this shows us that the benefits of ipilimumab may extend beyond just ideal clinical trial conditions and into the real lives of mesothelioma patients. Number 4, combining ipilimumab with other novel therapies could boost effectiveness even further. Lastly, a 2021 study from the Journal of Translational Medicine introduced an intriguing possibility. What if we combined ipilimumab and nivolumab with a telomerase vaccine to launch an even stronger multi-pronged attack against mesothelioma? Telomerase is an enzyme that is often overactive in cancer cells, but not in healthy cells. So a vaccine targeting it could be a powerful addition to immunotherapy. The study is still ongoing, but it represents the kind of innovative research being done to find synergistic treatment combinations to help patients live longer and better. Pretty incredible, right? But what about the side effects and the risks of ipilimumab? So the studies found that serious adverse events do occur in a subset of patients, including lung inflammation, brain inflammation, and heart failure. There were even a small number of treatment-related deaths. Severe side effects occur in about 30% of patients in the clinical trials. Careful monitoring and management of side effects with an experienced oncology team is crucial. Having a strong support system in place might be needed to achieve the full benefit of, dealing with potential complications. Another thing that you should take note of is that many of these studies looked at ipilimumab in combination with nivolumab rather than just on its own. And that doesn't mean that the information is useless. It just means that more research on ipilimumab alone would be ideal to flesh out its individual contribution. There can be a bit of a jump from combination therapy results to monotherapy expectations. So to recap, here's what we know. Ipilimumab helped extend overall survival. It provided a benefit for aggressive, non-epithelioid mesotheliomas. It showed promise in real-world use, and it may work even better when combined with other novel therapies. But will it work for all mesothelioma patients across the board? Unfortunately, we just don't have enough data yet to say for sure. In my opinion, it's frustrating that there's still a lot of research that needs to be done specifically on ipilimumab for mesothelioma. Despite how promising it looks, mesothelioma patients deserve dedicated studies to uncover the full potential of this therapy. So, what does that mean for you if you have mesothelioma? Well, if it were me, I would definitely want to discuss ipilimumab with my oncologist as a possible treatment avenue to explore. Maybe ipilimumab could be used as a first-line treatment to kind of kickstart a strong immune response against the cancer. Maybe it could extend life expectancy by months or even years in some cases. Who knows? But surely it's worth speaking to your doctor about. The research on ipilimumab for mesothelioma makes a really strong case for having an in-depth conversation with your healthcare team about whether it's an appropriate option for your clinical and unique situation. And if you're looking for more information on mesothelioma, please visit survivingmesothelioma.com to see how Paul Kraus became the longest living mesothelioma survivor in the world. I hope this information about ipilimumab for mesothelioma has been helpful and perhaps even a bit hopeful. Thanks for tuning in, and I'll see you next time.